So good afternoon. Yet another sunny day in beautiful Northern California. Today is Wednesday, June 10th. Wanted to get back to you with an update about our recovery. It's been now about 3 months since we started our de-escalation, and the COVID crisis really hit Sonoma County with our shelter in place, and a lot's happened since then. And I wanted to show you how much improvement we've made in our delivery of care to our patients since that time. I have 3 different graphs I want to show you that point out how we're doing. This first graph you're seeing now is plotting appointments arrived in our clinics. And as you look at the columns, in green are our in-person appointments, and above that are our virtual appointments. And you can see to the left there's 10 months of columns that present what I call PC, pre-COVID, and then it goes into April, then May, and then the last columns are actually the last 10 days of tracking. And you can see from this that we've made a gradual rise in our in-person visits. At the same time, we've made a gradual decrease in our virtual visits. The trend line I put in there is encouraging for all of us to see. On the other hand, this next graph is looking at something different. This is looking at billings. And once again, in green, we see our in-person visits, and in orange, we see our virtual visits. This graph starts from January 1, and each column is a week. And so you can see since the nadir, just right around March 22, how once again we've made steady and gradual progress in our revenues, as this one points out. And then the last graph is just another variation on the same theme. This is posted as gross revenue. And all in one graph here, you actually have 3 separate graphs in one. We have a graph noting April, then May, and then the first few days of June, starting from the left. And at the peak, I put some red stars, which shows the budgeted revenue, that is our target or our goal for each month. And then the yellow stars down lower show our actual revenues for April and May. And on the far right, I put a big bold yellow area that shows how we've started out in the month of June. And clearly in the month of June, we're tracking much more closely to how we did in the prior 2 months. So all these graphs are very, very encouraging to show that we are really starting to meet the pent-up demand from our patients, that we're starting to see more care. I do want to make a point about graphs because many of us are scientific and data-driven. As you go looking for data to see how we're doing, you have to be careful that you know exactly what time frame you're looking at and what data you're looking at. You certainly cannot compare encounters with revenues, for instance. And you might be careful about looking at, is the graph documenting when you closed a chart, or is the graph documenting when it was posted? So all that makes it a little challenging to read the data, but I do want to summarize again by saying it's all very, very encouraging. Everybody's doing a great job. I think we're starting to meet our patients' needs. In terms of individual data, for those of you who are production providers, we told you that every month we will get your data. The data for the month of May will be coming out, we hope, within the next week. We'll be delivering that to you. And I hope you have pleasant surprise to see that your month-over-month increase is satisfying to you and satisfying to your patients. This data that I presented is all cumulative. Bear that in mind. The data you're going to get will be individual data. Let me also speak to the different formats of our encounters. So you saw that we've seen a gradual rise in our in-person encounters. Of course, that's what we're used to. That was our whole life prior to the COVID. And I think this represents our patients coming in with their pent-up demand as well as their new comfort with coming in. The second thing you saw is our telephone visits, and we're seeing a gradual decline in our telephone visits. This was just made possible by the national declaration of an emergency, and this was made formally by President Trump on March 13th, and it was subsequent to that CMS finally relented and said that they would pay for telephone visits, and that was entirely new for us. I think we need to be cognizant of the fact that we don't know what role that will play in the future. Where that lies on the value spectrum, we don't know. There probably is a role for telephone encounters in the future, but it'll probably be very, very limited, perhaps related to ADA requirements. So keep that in mind as you plot your future. And then lastly, the video visits, which have been a lifesaver for both us and our patients. Undoubtedly, they're here to stay. But once again, we don't know the exact role they're going to play in our future. They also were a product of the National Declaration. They were a product of CMS increasing the reimbursement for those to be equivalent to an in-person visit. So as you plan the way you want to interact with your patients in the future, just bear in mind we don't know exactly what that role will be, where it's going to play out in the value continuum. We know it's here to stay and it works brilliantly for so many things. Time will tell how it's going to be used. Another bright spot that I want to announce is that life is getting back to normal in terms of us being able to provide comprehensive and integrative care. So our imaging unit is back up in all modalities. I'm told they're about 75% of their usual practice, and their primary restraint is the hygiene and safety measures, the strict measures that we have put in place that require them to clean the rooms as they turn them over. They're doing much better with their social distancing, and that has not been a problem to date. Physical therapy is wide open and ready for your referrals. Labs, of course, have always been open and continue to be open. It's kind of a nice time with our referrals to our specialists that perhaps right now you can get primary care, you can get your patients into a specialist sooner than you have in the past. And of course we have some new specialists coming this summer. In particular, I can just think of urology and rheumatology. We'll be seeing some new providers this summer that will help access there. Our ambulatory surgery center, I'm told, is now nearly up to their full function. And likewise at the hospital, I communicated with them yesterday and they said that last month had near normal volume in their operating room, still catching up on some of their procedures. So I do want you to know that there are still barriers to us getting back to the level of care that we want to provide. And I want to assure you that your leadership meets every morning. We have since this thing started. And our job is to identify those barriers to see if we can come up with solutions. And we really find that we're speaking in four broad areas. Staffing is a challenge because so much of our staff has necessarily been redeployed to things like the respiratory clinic, to things like jobs of screening at the entrances to our buildings. Of course, our dependence on other systems like the ambulatory surgery center, the hospital, that's been a big drag, a big barrier for us until recently. Social distancing has been a problem for some offices more than others where you share a waiting room. And then the last issue is our patients' comfort level with coming in to see us in our facilities. And I can't overemphasize how important it is that we continue to focus on safety. Some of our surveys with patients as recently as a month ago, 30% of them said they were not willing to come into our facilities. But we know the protocols we've put in place. Please communicate that to your patients. I personally am encouraged, and my family's encouraged by the fact that over this last 3 months, out of approximately 600 of us, both staff and providers, there's been no nosocomial infection with COVID-19 amongst all of us, and I think that can be very reassuring. So share that with your patients. Feel free, feel comfortable bringing them back in for the care that we know they need. And once they're here, they usually will say they're very, very satisfied. So that's what I want to say about the update. Everybody's doing a great job. You're providing a lot of care, and it's going to make a big difference to our community. So keep up the good work.